Good afternoon. I have a patient in front of me. We are getting ready to do the head, ears, eyes, nose, and throat exam. I'm going to wash my hands first, so 1 second. Okay, so I have my hands washed. I'm introducing myself. I'm Shane. I'm going to be your nurse practitioner for this evening. We're going to start with the inspection of the head. So we're going to look at the patient's head and assess the quality, distribution, texture, any pattern of loss. We're going to look at the head from different angles. So I'm looking at the patient right now, front facing forward. The patient doesn't have any lesions or scarring at the top of his head. I'm going to move to the side and assess the patient. The patient does have ingrown hairs that are growing on the right lateral side of his scalp. I'm looking at the back of the patient's head. I don't see any scarring. The patient is bald. I'm looking at the left lateral side. I don't see any lesions on this side. Old razor mark burns. So the scalp doesn't have any scaliness or lesions. We're gonna now look again at the size of the patient's skull, the contour. The patient's head is symmetrical. It is not distorted in any shape or size or contour. We're looking at the patient's facial expression, and any contours, any involuntary movements. The patient has a flat affect, no changes in the discoloration except for on the sides and on the bridge of the nose. Now we're going to palpate the patient's skull. We're going to look for any deformities, depressions, lumps, or tenderness. Is this tender here? No. Tender here? No. Tender here? No. Okay. We're going to inspect the temporomandibular joint area. We're looking for any swelling. I do not see any swelling in the patient's face. Next, we're going to inspect the neck. We're looking for some symmetry, any scarring or masses on the anterior, lateral, and posterior neck. I don't see any masses right now. I'm looking at the patient. Each lateral side is symmetrical. We're going to now assess the trachea and to assess for any deviation. We're going to assess the side. We're just going to push on each side. Now we're going to assess the thyroid gland at rest. Can you swallow for me? One more. And from there, we don't notice any negative traits with the patient swallowing. We're looking at the patient from the front, fully exposed lower neck. And now we're going to ask the patient to tip his head back slightly and swallow. Again. Okay. We're going to assess the range of motion in the patient's neck. We're going to have the patient flex, extend, rotate, and do a lateral bending. Can you touch your chin to your chest, please? Can you look up toward the ceiling? Can you look side to side over each shoulder? And can you bring your ear to shoulder bilaterally? Thank you. Now we're going to palpate the patient's lymph nodes again and assess the size, shape, mobility, the consistency, and the tenderness. What we're going to do is just post auricularly into the hair at least an inch mark or base into the skull and the hairline, along inferior jawline, TMJ to the middle of the chin, sternocleidomastoid, and interior and posterior to the SCM from the ear to the clavicle. So. We've already looked at the trachea to assess any deviation. We placed a finger between each trachea just to notice the space. Can you go ahead and look up for me? We're going to assess the thyroid again. We're going to have the patient swallow again to see for any movement, and we're going to displace the trachea to each side and palpate the lobes. Tilt your head up for me. Can you swallow? Again. Again. Thank you. So this concludes the portion of the head and neck exam. The next portion of the exam that we're going to include for the patient assessment will be the patient's auricles. We're looking behind the patient's ears. We're going to pull the auricle down on each side. I don't see any lesions. We're going to also assess the auricles, the trachea, and the mastoids for any tenderness. We're looking for any nodules or edema. We're going to pull the auricle up and down. Any pain?
No.
Any pain?
No.
At this time, we do not have an otoscope, but if we did have an otoscope, we would be able to use it correctly and hold the scope in a way that protects the patient from injury by using fingers or on the side of the handheld device against the face, and then we will pull the auricle up and down. Looking at the patient's nose, we do not see any masses. It is symmetrical, no deformities. How is your mucosa, your throat? Is it dry or wet?
It's wet.
Okay. His septum is non-deviated. We're looking at the patient's lips, slightly darkened. The patient does not have any lesions, no crackings or scaliness. Can you stick your tongue out for me? We're going to just use a pen light to assess the patient's mouth. And the patient doesn't have any lesions, any fissures on the tongue. Lastly, we're going to have the patient open his mouth. We're going to assess the teeth, the caries, the hard palate again, and the tonsils. Can you go ahead and open your mouth for me? There's no swelling. Looking at the patient's teeth. Don't see any cavities. Patient does not wear any dentures. For our next and final portion, we're going to look at the eye exam for the patient. At this time, we do not have a visual acuity board. However, we are going to assess the pupils of the patient. Can you follow this pen? Look up, look down, look left, look right. And this concludes the exam.